All right. Hello, everyone. My name is Connie Huynh. I'm the Healthcare for All campaign director with People's Action. My pronouns are she and her. I'm also a board member of Healthcare Now and the national chairperson of Affirm. So glad everyone is here. This is something I care very deeply about. And for some of you who do know, I did grow up without health insurance myself. So I am very well versed in how to avoid our healthcare system, but that had serious consequences for my family. And so I know the importance of how, we need to build a just healthcare system. So very glad to see everybody here. It is also very exciting to know that in the trajectory of history, we are on the precipice of very important change through the Medicare for All movement. It is critical that we organize more people into our movement during the pandemic and beyond. So welcome to our training. Just to give you a couple of things on logistics, there should be a button at the bottom of your screen on the right hand that says to show subtitles. So if you would like, you can turn those on. And then towards the end of the program, we'll have some time for a few questions. So be sure that to use the Q&A function to separate your questions from the chat, and that way we can help keep track of them. So again, welcome to everybody. People's Action is a national organization grounded in the interconnected fights for racial, economic, gender, and environmental justice. The roots of our organization are over 40 years old. If you name an issue, we've probably organized on it. And currently, we're most focused on winning healthcare for all, free college for all, a homes guarantee, the Thrive Agenda, and a people's bailout. And the power we build every day is because of our network of over 40 people-powered member organizations coast to coast in 30 states. We all know that we've been in a global pandemic for close to a year now. And it's been almost a year in a deadly pandemic and no meaningful solution, not even a real debate over ensuring that we all can get the healthcare we need. Everyone needs healthcare in a pandemic to ensure we don't keep losing people if we can help it, and we can. Our healthcare workers and workers in other essential functions continue to put their health and lives on the line every day that they simply show up to work. And for many, this is the most stressful period they've ever had on the job, and they're relying on us to get this thing under control. That's why we're holding this important discussion today with some of the best in this field, Dr. Abdul El-Sayed and Dr. Micah Johnson, to talk about how we got here and to lay down some fundamentals about what we need to ensure a resilient and just healthcare system. To start us off, we have our first guest speaker with us today, and she is a tremendous leader in her community, and her leadership is deeply felt in Milwaukee and in her international work in Mexico and other parts of Latin America and Pakistan. She's with us here today to share her experience with the healthcare industry. And so I am going to turn it over now to our fierce community advocate and leader, Norma Duckworth.
Thank you, Connie, and hello to everyone. My name is Norma Duckworth from Milwaukee, Wisconsin. I am a leader, advocate of local and international human rights issues, but most importantly, I am a survivor of COVID. I want to share a little bit of story of my background in my life, and I will share why I'm part of this and why it's important to bring awareness to not only the community, but outside in the US, why it's important when other people don't know what is going on within our health system. I am a mother. I am married to a veteran, over 25 years, 2 kids, and of course, can't forget my doggies, which are a very important part of my family also. About a year ago, a year and a half ago, my daughter, myself, and my son had a major car accident. Unfortunately, due to the car accident, my daughter had major trauma to the head. After the accident, my daughter continued to receive care. And I wanted the best that was for her. I wanted her to receive every care, whatever care was out there, to make sure she was receiving every part of it. So we began to do different exams. We began to search and do look around and find what are the best. We ended up with one of the hospitals at Children's Hospital, neurology, and it was where she was diagnosed with idiopathic generalized epilepsy due to the traumatic brain injury. During the process and the time, I realized that she was receiving extraordinary care. We had great insurance. We have two insurances. My husband's a disabled veteran, so we take his insurance, and we have my insurance from my employer. And so we have great insurance. During the process, we began to learn, as I was beginning to ask questions, if every kid that had this trauma deserved the same, did they have the same care that my daughter was receiving? Unfortunately, it turns out that they don't. And that to me really broke my heart to know that here is my daughter. She's receiving all the care that she needs. She's getting the best of care from the hospital. She's receiving all the tests that she's getting in the hospital and outside of the hospital. One thing that I learned is that due to the lack of healthcare, due to the lack of people not having the insurance, not having the benefits, not having these basic needs that are very important to human rights, they do not. So kind of fast forward that. A few months back, last year in 2020, I ended up getting COVID. I was at a dental appointment. Within the 24 hours of my dental appointment, I began to get sick. I got a cold cough. Unfortunately, I ended up with COVID. I ended up being hospitalized. It was a very traumatic process for me to understand and to know. And we ended up receiving all the care. But during this process, I understood and I learned that not everyone in this community and in America receives the same care because the lack of insurance. Through it and community members that I've worked with, I understood that there were many in this particular field that were not receiving the care. I'll be very brief and short. I had a resident who was a diabetic, was reusing the same needle. Due to the same needle, unfortunately, she was not able to get the care. She financially couldn't afford it. She ended up getting an infection and ended up passing away. So I thought to myself, how is it that in America this is happening? How is this possible that we're not able to provide basic care? And why is it important to have Medicare for all? Why is it important that we all get involved? Why is it important to bring awareness to this? The reason why it's important is that unfortunately, corporations up the prices on everything. Corporations, unfortunately, have us here in this particular position. And this is the reason why I continue to get involved. This is the reason why I continue to organize with Citizens in Actions of Wisconsin and People's Actions throughout. We continue to work, we continue to bring awareness, we continue to let people know. Last thing that I need to make sure that people are aware. People who live a great lifestyle, who are in a better condition, unfortunately don't know the main things that happen here. And so for this reason, I am involved. For this reason, we need to let people know and bring awareness why this is important, why we need to have, why we all need to be able to have Medicare for all in the US. Thank you.
Thank you, Norma. You are doing extraordinary things out there for yourself, for your family, for us all, and we really appreciate you and really feel what you went through. So thank you for sharing that with us. And that's why this fight for Medicare for all is so critical. That's why we're so glad that everyone is here and has chosen to spend this next hour with us and our special guest. We have an important discussion coming up, moderated by my comrade and co-conspirator at People's Action, Aisha Niemer Honorud. And so I'm going to pass it over to Aisha.
Thanks, Connie. I'm Aisha Niemer Honorud, Healthcare for All organizer at People's Action. Excited to be here with y'all. And even more excited that we've got some great guests joining us today. We have Dr. Abdul El-Sayed and Dr. Micah Johnson, who are both fierce advocates for Medicare for All. They're also co-authors of the new book, Medicare for All, A Citizen's Guide, which is out right now. Dr. Abdul El-Sayed is a physician, epidemiologist, public health expert, all-around progressive activist, rebuilt Detroit's health department after the city's bankruptcy as the youngest health commissioner in a major US city. And also, many of y'all probably know he ran for governor of Michigan in 2018, on a state level single payer platform, and was endorsed by Senator Bernie Sanders as well as Congresswoman Alexandria Ocasio-Cortez. Too excited, you need to slow down. Dr. Micah Johnson is a physician, healthcare researcher, writer, and policy advisor. He has served as a health policy fellow in the US House of Representatives and has advised presidential campaigns on healthcare reform. And we're so excited to have you both here with us. Thank you for joining us.
Aja, thank you so much for having us. We're so excited to be here with you. Really grateful for the incredible leadership that you and Connie and this movement show every day, and really moved by the comments that Norma shared and the experience that she shared. Really grateful that you're healthy and well, but you're right, nobody should have to go through this. So thank you all for hosting this amazing conversation today.
Yeah, thanks so much for having us. And I'm really pleased to see hundreds of people from all over the country who care so much about this issue. So excited to engage with you all today.
Great. So we've got a few questions for you here to kind of tap into your expertise. And one of them, just to get started, is, you know, pre-COVID, like, we've been in a perpetual healthcare crisis in this country for decades. The ACA passed in 2010, and that expanded healthcare to a lot of people, but we're still living in crisis. And then COVID happened, and we've seen that our healthcare industry could be failing people to a huge degree, and at the same time be making record profits. And so could y'all talk about just some of the greatest challenges that you've seen our healthcare system go through under COVID?
Yeah, there are so many. And I think the way you put it is exactly right, that we've been in this perpetual state of crisis. And then when COVID hits, we expose so many of the weak points in our system. So if you think through about what this has meant in folks' day-to-day lives, it means that when they're losing their jobs during the pandemic, millions of them are losing their health insurance. It means that there are tens of millions of people, and predominantly in communities of color, that have lacked reliable access to primary care for decades, who are accumulating untreated chronic conditions that make them sicker with COVID. So communities of color more likely to get COVID, more likely to end up in the hospital, more likely to end up in the ICU, and more likely to die from the disease. And then, because of the way that we set up our insurance system, where even if you have insurance, you still have to pay so much to get the care that you already paid for. You have people that are afraid to get tested for COVID because they don't think they can afford it, and they're afraid to go into the hospital. So I think the problems that are illuminated by COVID are there for almost every other disease that people get, but it's a unique moment where we're seeing the acuity of the issues like we've never seen before.
Yeah, I think that's right, Micah. You know, I keep hearing this idea that we want to go back to quote unquote normal. But we have to remember that normal wasn't all that normal for a lot of folks. And the reason why is because our healthcare system has failed people. I was the health commissioner in the largest majority Black and poorest city in America. 50% of the people in my city, whom I was responsible for their public health, 50% of them relied on Medicaid for healthcare. And Medicaid is a great program, but they always, you know, there's a great quote that programs for the poor are a recipe for poor programs. And we have a responsibility to collectivize these programs, recognizing that one of the most important things about Medicare for All is that it puts everybody's body on the same playing field. It doesn't mean that the reimbursement for the same care that you get if you're a Medicaid beneficiary should be so much lower than you get for someone who has private health insurance, because we know that that has an impact on the kind of hospitals that are going to move into communities where people are predominantly on Medicaid. And then the other thing that we have to remember is that I want everyone to think back to the bad old days in March, in the beginning of this pandemic. You had nurses and hospital staff and doctors who couldn't get basic PPE because they were told by management consultants that if you want to run your hospital and make money off that hospital, that you shouldn't be stockpiling these basic things. Well, that fails in a pandemic. We saw nearly somewhere between 5.4 and 23 million people lose their health insurance in the middle of a pandemic, worried about what might happen if in fact they caught this serious illness. And then now, right, we're in a situation where 12 hospitals closed in the last year alone, simply because we rely on them, right, to make their money, to stay open, to care for people in their communities, by being able to, in effect, pay the bottom line with elective procedures. Well, you cancel those elective procedures, and all of a sudden those hospitals are facing bankruptcy and COVID at the same time. So the system was built to fail. And the last thing I want to remind folks is that it doesn't have to be that way, right? The reason it was built to fail is because we are the only high-income country in the world that relies on a middleman system of 900 health insurance companies whose CEOs are generally making in the tens of millions of dollars, right? To tell us what healthcare we can have and what we can't. So when people say Medicare for all will take away your choice, well, the health insurance companies are taking away your choice. When they say that Medicare for all is going to cost too much, well, the health insurance system is taking $15 off the top of every $100 that is spent. And they tell us that it's going to ration care. Well, anybody who's ever had to use their health insurance knows that they don't want to just pay out for your care, right? They want to fight you for it. They're trying to ration your care. And so we have to stand up to the corporations who have put the chokehold on our healthcare system and tell the truth about what we could be doing in this country if we were serious about actually dignifying the right to healthcare that everybody should have.
Yes, thank you both. It's really exciting to hear that. Just like how much more is possible than we often are able to imagine because we live under this whole system, right? And speaking of that, you both have just released a very timely book, Medicare for All, a Citizen's Guide, and that details a lot of the policy, a lot of the political terrain related to Medicare for All. I'm sure a lot of our listeners are pretty familiar with Medicare for All, but some may not be. Could you just give like kind of a brief description of the basics of what this system would do?
Sure. So in the book, we say that Medicare for All means that everyone in the country would have comprehensive health insurance under a single publicly funded plan. So you can think about it, we're really doing two things. One is we're making the current Medicare program better. So folks who are on Medicare know that there are some problems with it. It still has a pretty high deductible. It leaves out certain services like dental, vision, and hearing. You got to pay extra for drug benefits. So let's actually make Medicare as good as it can possibly be. So it's covering a full range of services, get rid of the high deductibles, make it affordable for people to use. Then the second thing is put everyone on Medicare.
Yep, and the thing I want to add to that, and that's exactly right, Micah. The thing I want to add to that is that it's a simple program, right, that has a number of cascading benefits on the back end of the way that the healthcare system is structured, right? In American healthcare, you're here, and then you've got providers of healthcare, so clinics and hospitals and pharmaceutical companies, they provide you medications. And then you've got payers, right? And payers is this weird jargon term, but they're the insurers who pay for your healthcare if and when you get sick. So you're here in the middle, right? And you get sick, you go to the providers, you get your care, and then they bill the insurance that you've been paying for, right? That's if you're lucky enough to have insurance. And if you're older than 65, your insurance company is the federal government. And if you're poorer than a certain level of poverty, your insurance is also the federal government through Medicaid, okay? But I want you guys to understand something here. There are 900 of these guys in this country, and there are thousands of these guys in this country. And the way that prices get set have almost nothing to do with what the right thing for you, the patient, is, has everything to do with how you can compete against the other people in your bracket, right? So if you're a health insurance company, you want to get bigger and buy out the other health insurance companies. And if you're a hospital, right, you want to get bigger and buy out the other hospitals. And so what happens is they're all setting prices in ways that leave you, the consumer, out. So costs go up and up and up because there's really no incentive to care about you. And so if you have one payer, that's why we call it single payers. Out of 900 of these guys, you got one, right? Now, the rate's going to be the same no matter which one of these you are, right? And because you are the taxpayer who pays for this, the government, right? Now they have a real incentive to actually set prices in ways that benefit you. And a lot of the cost of our healthcare system, the spiraling costs, right, you can address by having one payer, plus the overhead between all of these guys trying to crosstalk, all of the billers that each side has to offer, right? They go away. And so you save money off the top immediately, right? You now have a government health insurer who cares about you and provides healthcare for everybody, right? And the system that was creating the skyrocketing costs, that goes away. The incentives fall away. And so it's a simple approach to addressing a very big problem. And one way to think about it, right, is that imagine you're trying to cover your whole body and you're cold, right? You might have a quilt, and the quilt's put together between a whole bunch of different little pieces. But if one little piece falls out, right, and it's over your knee, now your knee's going to get cold, right? And so now you got to cover your knee, but then you lost your foot. You got to cover your chest, and you lost that too, right? But imagine having one blanket. You have to worry about the holes. Yeah, that's the idea here.
Wow. I've been working in healthcare advocacy for a bit. I feel like that's the best description I've ever heard. So thank you. that cleared things up for me a bit. And how, like, applying this to the times we're currently living in, like, how might our response to COVID have been different if we actually had a single payer Medicare for all system?
Micah, you want to take that? You've been working in the system day in and day out. You want to talk about that?
Yeah, I mean, the most obvious thing is that, and this is what happens in almost every other high income country, is every single person in the country would have health insurance before, during, and after the pandemic. And we've kind of normalized this idea that millions of people are, oh, of course they're going to lose their health insurance during a recession or during a pandemic, but that just should not be the way that it is. Everyone should keep their insurance the whole way through. But the other thing is, I've earlier this month worked in one of our ICUs and saw how patients get so deeply ill with COVID. And so much of it has to do with the exposures that they've had before they came in. So we've set these folks up for failure who've had, whether it's untreated infections that, then scar the liver and lead to cancer, whether it's lung disease that we haven't treated for so many years, and then they're susceptible when they get this virus. This could be so different. I think if we have a system where you're actually delivering care to people when they need it and not rationing based on income, but giving it to people based on need, I think that would leave us so much better equipped to deal with this. But then there's also ways, more invisible ways, that, as Abdul's talking about, the private insurance system structures where healthcare institutions and where doctors are. So Medicare and Medicaid in particular pay much lower rates than private insurance. So if you're a profit-making hospital, you're more likely to build your hospital in places with wealthier and whiter communities. And that's a huge problem. It's one of the ways that private health insurance kind of perpetuates structural inequalities. And under Medicare for All, doctors and hospitals would get paid the same no matter who the patient is. And that form of equality in how we pay for healthcare also lead to more equality in where doctors work, where hospitals are. And then you have things like, well, now when COVID hits, maybe you have more equitable testing sites. Maybe you have more equitable vaccination sites. So really by making the changes that we're talking about, by actually treating everyone equally in their healthcare system, that would have left us much, much better equipped to deal with COVID. And because these problems are going to exist not only for the rest of COVID, but even after, God willing, the pandemic is over, we're still going to have these inequities, and moving to Medicare for All would make a huge difference in our ability to respond.
Also, that's a great explanation. I also just want to throw in one more piece of this, and that's the fact that we do not spend money in this country on preventing disease, right? There's a world where we would have been able to nip this pandemic in the bud because we were able to deploy high quality contact tracing early on when the virus hadn't been full blown and vastly spread. And the reason we don't spend money on prevention is because there is no incentive in our system to prevent healthcare, to prevent disease. In fact, right, my argument on a lot of this is that the system exists in a way, right, that capitalizes on your fear of getting sick. And so if there's a lot of money to be made on people getting sick, there's very little incentive to prevent people from getting sick in any real way. And so in the micro scale, you look at any one of these insurers, and there are, and we talk about this in the book, there's this large level of churn between insurers. So you may be covered by one insurer today, but the high probability is in the next 10 years, you're going to be covered by someone else. And if you think about prevention as an investment today, right, to try and limit your probability of getting disease in the future, if your investment is only going to pan out, but to another insurer, or in the ultimate case, to Medicare, because that's what you hit when you're over 65, you're not going to spend that much money on trying to prevent disease. And so insurers don't. And so there's a deep disinvestment in terms of prevention and investment in public health and in primary care in this country. And so we've got to change the playing field. We've got to be moving the entire distribution of illness back further. So we're investing in public health, we're investing in prevention, potentially investing in state and local health departments and the CDC, the kinds of institutions that would have been critical to containing COVID-19 in the first place. And folks have to understand that in this country where we've monetized illness, and we've profiteered on people's bodies. The end consequence is that when people get sick, people get paid. And that's a real problem from a political economy standpoint.
Yeah, well, and all of this is like, yeah, I feel like it's easy for this to get abstract, but like what this actually amounts to is real people's loved ones who would still be here today if we had this. And when we look at a future pandemic, like real people who, would be with us. And not to mention the everyday toll of 60,000 people a year who die from lack of care in the US. So
Actually, I really appreciate that point. I want to jump into that point real quick, because when we talk about the health system, right, it does get real abstract, and we forget that there are real people who have real loved ones, who have real hopes and dreams that get snuffed out when they pass because we failed as a country to dignify their right to healthcare, right? And this is where the conversation the rubber has to hit the road on this conversation. These are real people's lives. We are actively failing as a country. And like the other side of this is that, we're having a healthcare conversation, and it's easy for us to keep the bounds of the conversation in healthcare. But the fact of the matter is, right, we spend more in our country on our military than the next 10 countries combined, right? And that's all money that's being invested in taking lives abroad, right, rather than saving lives at home. And so we have to ask a question about why are we invested, right, in this and not this? And why are we so okay to allow a set of corporate interests to drive both, right? The military industrial complex on one side and the medical industrial complex on the other. And so this is a bigger conversation about what we in this country, in a democratic society, should we be able to hold on to it, right, are willing to invest, to keep, and to defend, and to empower. And I think we all have to recognize, right, that when they tell us that there's not money for it, then the question has to become, why is there money for this but not this, right? And who stands to gain off of doing more of this and too little of this?
yeah, and so on that note, how did we get here, like to this system that is just, doesn't work at all?
I think the history of how we got here is super important. And we spent a lot of time in the book tracing out the last 100 years of health reform to how we got here. And of course, if you want the details, check out chapter 2. But the one part that I'll highlight is the role that the healthcare industry has played for 100 years fighting this. And even back to FDR in the 1930s with the New Deal, there was an original draft of Social Security that would have made healthcare part of Social Security. But even FDR thought that, he said, I can't stand up to the state medical societies. They're just too powerful. The doctors who were willing to argue against having national health insurance were so powerful that FDR was afraid to even take them on. And then when Harry Truman tried to take them on in the 1940s, some of you may or may not know, we had a sitting president who endorsed single-payer healthcare, Harry Truman, in the 1940s. And they proposed the plan, and the American Medical Association launched the single largest lobbying campaign in the history of the country to take down national health insurance, and it worked. And it was only in Medicare in the 1960s, the American Medical Association, doctors, again, tried to take down Medicare, but this time, the organizers won. It was seniors, and it was the labor movement who organized in communities around the country and put those votes into the ballot box and had a huge landslide election victory in 1964 that allowed Medicare to get passed the next year. So could go on, but for the first half of the 20th century, doctors were really primary opponents to health reform. Now healthcare has become much more corporatized in the last 50 years. So it's become pharmaceutical companies and the insurance industry and monopoly hospitals who are the biggest opponents of health reform. They took down Clinton's reform in the 90s. And it was because those industries are so powerful that the Affordable Care Act was designed the way that it was. One of the major parts of the political strategy of the Affordable Care Act was, let's bring the healthcare industry into the room and see if we can figure out a reform that they agree with. And if that's your political constraint, there's not a whole lot more that you can do than what we already did with the Affordable Care Act. So when we look towards the future of health justice and making healthcare a human right, there is no way to get there that doesn't involve overcoming the opposition of these industries and frankly, that is why the work that you're all doing in this organization is critical, is absolutely central to have the people power strong enough that's going to overcome the forces that have been setting us back for literally 100 years.
And that's very helpful history. And there's also a component of that struggle in the 60s around racial justice too, right? And like, that's Medicare is how hospitals were desegregated in the first place. Is that correct?
That's a really important point, Ija, and I want everybody to pay attention to what they're saying. Look, the conversation in the 60s about Medicare, the central fear tactic that was used to fearmonger people about what might happen if we passed Medicare, was that it would desegregate our hospitals. And I hate to say it, but a lot of the biggest barriers that we face to Medicare for all have everything to do with racism. It's the notion that people are unwilling to invest in a collective resource that they think people of color are going to use, despite the fact that, as we lay out in the book clearly, that many of the arguments that people are having about this are completely bunk. And yet, it is one of the biggest barriers that we have to taking this on. And so we've got to call out racism in the way that it interferes with our ability to invest in public goods generally, but in particular, when it comes to our ability to provide universal, high quality health coverage for every single person in this country.
Yeah. Well, so with all of that in mind, we've got like eye on the prize, Medicare for all, single payer. But right now, there is not much political will in Congress to make that happen, despite having Democrats in control, right? At the same time, we are still deep in this pandemic. What are some of the best solutions to address the crisis we're in right now, knowing that Medicare for all is not on the table at this moment?
I think, look, right now, the conversation about immediate aid is important. And I had the privilege of sitting on the Sanders-Biden Unity Healthcare Task Force and worked quite a bit with Micah on that front. And we know we have a president who is not supportive of Medicare for all, although we should keep driving the conversation, both to hopefully achieve it in this administration, but certainly to achieve it in the future. But one of the most important pillars of what we were able to come out with was a truly public option. And one of the frustrations I have with the way that we're thinking about this current COVID crisis is, rather than invest in putting people who have lost their employer-sponsored health insurance because of the rickety nature of this system onto a public plan that they would not lose if their employment changed. Instead, right, we are basically handing money over through COBRA subsidies to large health insurers who, by the way, have made bumper profits in 2020 because they didn't have to pay for elective procedures, and because the people who were bumped off their rolls during 2020 tended to be their most expensive patients. And so the idea that we are handing that money over to these corporations that have already failed these people, to me, is absurd. And it's a very clear reason why. In 2020, the health insurance corporations, their lobby spent $151 million across 845 lobbyists to secure outcomes like these. And so, we talk in the book about the power that industry really does have, and we can't blanch away from that. That's real. But the only way that we take that on is by calling it out and building people power against it. And so this is one of those spaces. Look, I wholeheartedly support the American Rescue Plan, and I think it needs to pass. But I really wish it did not include $57 million to health insurance corporations that had already failed the public. I really wish that we were talking about the plans that have been both proposed in the Senate by Bernie Sanders and in the House by Representative Jayapal to enroll people on what could become the public option and what should become the public option, as the Biden administration itself has committed to when it was still in campaign phase.
And so, like, knowing that we need change right now, like we are in an immediate crisis, we need to be winning things that will give people relief now and also be moving us closer to Medicare for all. What do you see as some of the best organizing opportunities right now?
Yeah, I think some of the initiatives that Abdul described are really important in terms of, part of it is what are the policies to organize around? And I think about things similarly as Abdul does, where once for folks who support Medicare for all, that provides a vision of the direction that health reform should be going into. And then that gives a test for how to see whether something's going to move us closer to that or not. So one of the things that comes out of the Medicare for all conversation is the failures of employer-based insurance and the failures in our private insurance market. And just like Abdul is talking about, how can you actually make our public programs better and get more people on them? And how do you show folks that you can use the tools of government to make their day-to-day lives better? So I think those are the things that we should be focusing on, is how can we make people understand and trust that government action can make their healthcare experience better? And one of the other things that I think is a big win that's in the Sanders-Biden Unity platform is negotiating drug prices for everyone, where what's in there is to say, okay, Medicare is not just going to negotiate drug prices for seniors. Medicare is going to negotiate drug prices on behalf of all Americans. And that, to me, it's kind of a piece of Medicare for all, but applied to drug prices. And that's something that would make every time folks go to the pharmacy counter, they could see the difference that these policies are making. So that's in terms of policies to organize around. But I think the other piece is there are some really important developments that are happening in our conversation around COVID that I think can be leveraged. And one is there is rightful attention being placed on healthcare workers, and not the healthcare corporations that they're working for, but seeing that nurses and doctors and pharmacists, environmental service workers who have been on the front lines of this pandemic, I think having more and more organizing around those folks as a cohesive political bloc, I think makes a big difference, because I think, you're in a really powerful situation if you have nurses, pharmacists, and doctors who are standing up to the healthcare industry writ large and saying, look, we're going to try to stand up for health justice and what's right. I think that really changes the politics around healthcare. And the final thing is a lot of the conversation that we're having around caring for people with COVID has flipped the last 40 years of healthcare conversation on its head, where for 40 years, we're talking about healthcare as a consumer product and how do you incentivize companies to compete on a marketplace. And we're not talking about that with COVID. We're saying that we need to get this vaccine to everyone in the country because they deserve it. Or in the Biden platform, we're going to pay for tests and treatment at no cost to everyone in the country. And we haven't really been highlighting this, but those are critical developments. This flip of thinking about healthcare as a public good and as a human right. And the more that we can have those messages dominate the healthcare conversation, I think that really paves the way towards more fundamental reforms.
Absolutely. Did you have anything you wanted to add, Abdul?
No, I think Micah really hit the nail on the head. We have to remember that the future is ours, and it's going to take all of us working to get there. One of the things that the industry wants us to believe is that we cannot win, and they want us to think that it is impossible, that we will always fall flat on our face. And we have a responsibility to keep the optimism forward and to remember that the future, in fact, is ours, that the greed of the industry has shown it to be a failed approach to providing high quality, dignifying healthcare to all of us, and that we have to keep driving. And so it's going to take us doing the basic work of organizing, the work that all of you all are doing in the communities in which you live, to drive the conversation and build the future we want to live in.
Yeah, absolutely. And I'll just add from my own perspective as an organizer on this, I feel like one of the things we need to be doing right now also is really breaking the tie that corporations have to our actual elected representatives by, calling out, like, you are acting in a way that is beholden to these insurance companies, these pharma companies, not in a way that is actually in the interest of your constituents, and make that a political problem for them. So excited we've got some plans to do some of that stuff this year. So that's it for our planned questions. We're going to go to some questions submitted from the audience now. And we got one from Asha Rajani. Apologize if I'm mispronouncing that. Racism is a public health crisis is a phrase many public officials have used a lot over the past year. Can you talk a bit more about what this and social determinants of health means and how a Medicare for All type healthcare system in particular can help to address this?
One way that we have to recognize when we talk about the social determinants of health, what we're saying is that health happens in ways that supersede what happens underneath the skin, right? It's not just biology that creates the pathology that we see that takes lives too early and too often among low-income people and among Black people and other people of color. It's the way that society is shaped to offer or not offer resources to particular groups of people. It's about the way that you are treated from the very day that you're born in terms of the community you get to live in, the housing you have access to, the air that you breathe, the water that you drink, the jobs that you get to get, the segregation in your local community, the economic activity that exists, the likelihood of being victimized by either someone who lives in your community or the state itself through the police. All of those things shape health. And if we're serious about addressing health disparities, right, the deep inequities that we see in almost every health outcome that we measure, we can't just focus on what happens in the clinical or hospitals. We have to focus outside of them. Now, what I just told you seems incongruent with a conversation about healthcare. The issue here, though, goes back to the broader point that I made about the way that we allocate our health-focused resources. And so the system as it stands, right, the healthcare industry wants you to think that it is independent of all of the other issues that we have to deal with. But when you take health insurance out of the corporate sector and you put it squarely as a responsibility to government, then you align the incentives to take on all of the broader social determinants to address, right, the ultimate healthcare outcomes that you see. And so in a lot of ways, right, I remember we were having an interview with a former Obama health official. And her point was that, you know, we will not achieve the kind of health outcomes that we want in this country until we subjugate healthcare, right, to the broader conversation of social well-being and public health. And Medicare for All has the potential to do that in a way that a corporatized healthcare system simply cannot.
All right, thank you. Just taking a look at our questions here. Why use Medicare as a model instead of universal health care that other countries use?
So
Mike, you want to?
Yeah, I can talk about this. So I would say two things. I think from a human rights and policy perspective, we don't need to get too caught up in language. You know, what we want is guaranteed healthcare for everyone in the country. And I think that's clear. I think the reason that the movement has settled on Medicare for All as the label is people know and trust Medicare. It's one of the most popular social programs in the country, polls very well, Democrats, Republicans, independent, no matter what age you are, people know and understand it. And I think it's done better. You know, a couple decades ago, single payer was not only what policy wonks would say, but that's also what we talked about in the political sphere. And I think there's just less resonance. Single payer tells us kind of about, the means, but what we really want is to have everyone have healthcare. So, I think there's fair debate to be had about language, but that's why historically Medicare for All has turned out to be the label that lots of us are using for this program.
I will also say that I think Micah's point is spot on, that there are so many different ways that high-income countries around the world, frankly, not high-income countries around the world, have guaranteed their people access to basic access to healthcare. There are a lot of different ways to do it. Both Micah and I actually went to grad school in the UK, where we got access to not a single payer system, but a single provider system, meaning the government not only is your health insurer, it is also your hospital, your clinic, and your public health system. It's all integrated. And one point to be made about that, right, is that opponents of Medicare for All often try and paint Medicare for all as if it is some sort of extreme, right? That it would just be this government, quote unquote, takeover of healthcare. But actually it's not, right? Because a government takeover of healthcare is what happened in the United Kingdom. And actually, if you talk to anybody in the United Kingdom and you ask them what the best thing about their government is, they'll point to the National Health Service and say, that is the best thing. In fact, I think it was like the UK Person of the Year in 2019. I mean, people love the NHS, and for good reason, because I remember when I was there, I cracked a rib playing rugby of all things. And when I went there, right, like I had a great experience. And guess what? They didn't perform all the unnecessary care I probably would have gotten in the United States. I remember walking in and telling the doctor, it hurts when I laugh. And he in a very British way looked at me and said, "Stop laughing." I was like, "What do you mean by that?" He was like, "Listen, I was a medical student." He's like, "You're a medical student, right?" I said, "Yes." He said, "Okay, well, do you think that your ribs are displaced, meaning that the ribs are not aligned with each other? Because if it was displaced, that'd be a real problem. Like you could cut a lot of important tissue down there if it was displaced. But if it's not displaced, it's just going to heal, right?" And I said, "No, of course not. It's not non-displaced because I'd be in a lot more pain." He was like, "Okay, so what do you want me to like give you an x-ray?" I was like, "Yeah, in the United States, I'd have gotten an x-ray." He's like, "Yeah, you know why? Because your doctor would have made money and the x-ray consultant would have made money. And they're worried about getting sued. I'm not going to do that because it's a waste of care. Just, he's like, just be careful on it." And he was entirely right. And so the point is that they have a more efficient system, but everybody gets access to it because they're not wasting all kinds of money trying to bill my insurance, right? Because I'm a paying customer and they got to milk me for all I'm worth. And so the point I'm making here is that it is not an extreme takeover of healthcare, right? All it is a right sizing of the system that we have. Your doctor, your hospital, your pharmaceutical company, for better or worse, stays private. But what becomes public is the insurance system. And the insurance system has been shown to be deeply ineffective at providing everyone coverage in a thoughtful way, in an efficient way. And so this is not a takeover of healthcare. It is a takeover of insurance, which is unfortunately unnecessary.
Yeah, well said. And another question here, what are the costs to society of having millions of Americans with no healthcare coverage?
I mean, simply horrible cost. I mean, we know that being uninsured makes you more likely to die. I mean, that's just the simple truth. And we've got 30 million people with no health insurance. It's unconscionable. And, I think during the pandemic, we see how that affects everyone. No one benefits when your family members and your neighbors can't get healthcare. So I think, it's a good reminder that the economic toll of having people uninsured is terrible, contributes to hundreds of thousands of bankruptcies. Healthcare costs push millions of people into poverty every year. But at the end of the day, this is people who should not be dying and that are in our country, in the richest country in the world. So I think it's that core point that I think is why so many of us have been drawn to this issue. It's really a question of making healthcare a human right, and that is something that's very powerful to organize around.
Both Micah and I went to medical school because we really wanted to heal folks. And I think both of us saw that in the system as it is currently designed, the central goal may be articulated such that we want to heal folks. But really, every institution in American healthcare is intending to do one thing, which is maximize a bottom line. And the moral rot at the core of that idea, I think, should force all of us to take a good hard look at what we've allowed to exist and persist in our country. And that in and of itself, right, is a wrong that on the back end, as you pointed out, Aisha, on the back end, there are millions of people who either go into debt or worse, die because they don't have access to basic healthcare. And I want to speak to a comment that somebody made in the chat just about the last point that I made about the very wry doctor that I saw in the UK. It's not rationing not to give you healthcare that you don't actually need. It's just efficient healthcare, right? In our country, there is a tremendous amount of care that is delivered to people who have good paying insurance that they don't actually need, but because someone will pay for it. And that's part of the consequence. We don't talk about that, right? We're here focused on the people who don't have healthcare at all. But it's not that we don't provide enough healthcare in America. Actually, we provide probably more than enough healthcare. We just don't provide it to everyone. So you've got a group of people who are insured, who are often getting more care that they need, right? And actually getting billed on the back end of it. And you've got a group of people who have just been rationed out of healthcare. And so rationing in our country actually does exist. And instead of rationing by the care you need, you are rationing by whether or not you can pay. And that is part of the moral rot at the center of our system.
Related to that, this will probably be the last question. How do we convince those fortunate folks who have better healthcare coverage that they will not lose good healthcare? If we want to get more folks on board, we need to be able to convince them as well.
Let me say a couple things about that. Number one, a lot of the people who think they have good healthcare haven't actually had to use their healthcare. Oftentimes people assume I'm insured. And if I'm insured, I should be sure, because that's the operative term in the word insurance. And then lo and behold, something happens and they get sick. And that insurance, right, is now charging them more than they can pay in an entire month, their entire monthly paycheck, right, or more for a deductible. And we interviewed a woman named Lisa, incredible human being, who's been a real advocate on this. And she was insured and ended up having, because of really bad luck that she and her husband sustained, ended up having to, put out a GoFundMe, and are still in debt, have to negotiate with their healthcare, their health insurer. This is the point: is it's not sure, right? And so you may think you have good healthcare until you actually need to use it. And the second point I'll make is this: is that this system is quickly becoming unsustainable for everyone. What we're seeing is that premiums are going up, deductibles are going up, and so if today you're lucky enough to be able to pay for it, tomorrow, the next year, it may not be that way. And so we have a responsibility to address the system, right, that is driving care to be unsustainable for more and more people every year.
Yeah, and I'll say a few things on this, and that's spot on, Abdul. And one of the threads that we trace out in the book is, one of the architects of Medicare had this great quote, which is that in the United States, only when the broad middle class is being hurt do we turn to universal programs addressed to all of our citizens. And in healthcare, we argue that that's where we're at now. It is tens of millions of people, even folks who have stable jobs and have so-called good private health insurance, they are being hurt by the system with the high deductibles, the surprise medical bills, the instability of their insurance. It is a very common experience to be harmed by our healthcare system. It's not just the uninsured. And I think one of the critical tasks for organizers is to stitch together the interest of folks who have no insurance and folks who do but are dissatisfied with it, to bring those folks together as a cohesive block. And the last thing that I'll say is, one of the most effective scare tactics on Medicare for All is to say, oh, if you have private insurance, you're going to lose your healthcare. But the way that I think about that as a primary care doctor is, I think, okay, I've got patients on my clinic schedule for tomorrow. Some of them are on Medicare, some are on Medicare, some are on private insurance. And they're all being told that they're going to lose their healthcare if they go to Medicare for All. But if Medicare for All was in place tomorrow, here's what would happen. They would all show up to that clinic visit tomorrow just as they had previously scheduled. They can keep their doctors and keep their hospitals, but what would be different is now they could afford any medication that they're prescribed. I could get them to get into the diagnostic test that they need. If they got sick, they could call an ambulance and go to the ED and go to the hospital without fearing bankruptcy. So I think we can really turn this on its head, where we want to talk about choice and we want to talk about freedom. People's choice and freedom is restricted so severely in the status quo, and that under Medicare for All, people would be free to get the healthcare that they need. And as a doctor, I would just love that for myself and for my patients, which is one of the reasons why I'm so passionate about working on this with all of you.
Wow. Well, thank you both so much. This has been a great conversation. I'm sure everybody in our audience learned a lot. I learned a lot from y'all, learned how to talk about this stuff, and excited to keep working together in the future. So thank you. And I'm going to turn it over to Connie to close us out here.
Thank you. Again, thank you so much, Abdul and Micah. This has been so informative, thorough, grounding, Medicare for all. We want that, right? So many people in our communities didn't survive this pandemic, as we all know. We didn't survive, the 45th president. So many people have lost loved ones and things that we may never get back, right? But we've taken incredible steps. We did the first big thing of ejecting, the occupant in the White House, and we're ready to do the next big thing. And so we're ready to make sure that Biden, the democratically controlled Congress, actually take action on the things that we need, right? And so if you are ready to take action to win real COVID relief right now, sign up for one of our Deep Canvas phone bank trainings into the 3 critical states of West Virginia, Missouri, and Arizona, so that we make sure Congress passes the kind of relief our communities need and deserve, including $2,000 monthly survival checks. There's a link that should be coming in the chat. And if you are fired up from this conversation, if all of your, brain cells are tingling right now and you want to take on some leadership in the fight for Medicare for all, fill out the form that is coming to you in the chat. An organizer will contact you to figure out a role that makes sense for you in the movement for Medicare for all, whether it's with us as People Action, whether it's with one of our allies. We need everyone in this movement that we can get. So again, look out for that sign up form. And finally, for the full story and analysis, believe it or not, this was just the tip of the iceberg. You can get the full analysis from Dr. Abdul El-Sayed and Dr. Micah Johnson if you get your copy of Medicare for All, A Citizen's Guide, which again is coming to you in the chat. So again, thank you everyone. Thank you Norma Duckworth, Dr. Abdul El-Sayed, Dr. Micah Johnson for all bringing the light in the fire that we all needed. Thank you to Aisha for moderating, and also our incredible team in the background, Catherine, Matthew, Emma, Hannah, Shantae. Thank you guys so much. And much respect to everyone who is out there joining us live for this COVID teach-in on Medicare for All. Again, it was Black leaders who fought and won Medicare and the desegregation of our hospital industry. And now it's us, right? We're building a multiracial movement to win Medicare for all. So onward, and we will see you guys in the streets, online, wherever it is. And everyone enjoy the rest of your weekend.